Hello, and welcome to the Stem Cell Healing Institute podcast. In case you have any questions regarding this program, please write us at info@stemcellhealinginstitute.com. Thank you and enjoy the podcast. Hello and welcome to the Stem Cell Healing Institute podcast. My name is Luis and I'm here with Dr. Sara Figueredo. She is the director of the institute and she is currently in Canada visiting some patients. So, doctor, how are you? How you doing?
Thank you. I'm very well. Thank you so much for having me, Luis. It's nice to be in winter wonderland here.
Is it cold over there? It must be really cold in
It's
this time of the year, right?
Yes, I'm in the interior of BC and it's snowy. It's quite mild, but snowy. That's the best part.
Oh, nice. So enjoy the rest of your trip. But we is still doing this podcast because, well, you guys are listening to it. So we cannot stop doing this podcast. And we have a very interesting topic today: how stem cells can help liver damage, right, doctor?
That's right. Yes, and any organ really, stem cells can help with regenerating so many tissues in the body very successfully. And liver is one that is very responsive to stem cell regeneration because the liver itself can regenerate itself to some degree even without stem cells. So it's one that responds very well to stem cell therapy.
But I believe there are like different diseases, if we may call them, like cirrhosis, fatty liver, that can affect this, that we can help with the stem cells. And
Yeah, so liver damage can occur for different reasons, with because of different reasons. So, like you mentioned, cirrhosis of the liver, fatty liver, in other words, which can be caused by alcohol and non-alcoholic cirrhosis of the liver, as well as organ damage caused by COVID, organ damage caused by other diseases like diabetes, uh, and cardiovascular disease, which could inhibit blood flow to the liver, as well as just generally lifestyle that can lead to and other diseases like hepatitis and lifestyle that can lead to damage to the liver. And with cirrhosis, we have a lot of patients coming in with non-alcoholic cirrhosis of the liver, and which is
because sometimes
again.
that is provoked because of the diet, right, doctor?
That's Yes, Luis, that's right. What happens is with non-alcoholic cirrhosis of the liver, a patient will come in telling me, well, um, I don't even drink. How can I have cirrhosis of the liver, which is typically caused by alcohol, high amounts of alcohol in the diet? And my response is one of two things. The fact that certain foods in our diet can literally lead to fatty liver. Two of those foods are corn and corn byproducts in corn, as well
Imagine
as
that, all the
peanuts.
tortillas that we eat.
Yes, that's right. And yes, and you know what? In Latin America, where our clinic is in Guatemala, we see a lot of cases of non-alcoholic cirrhosis of the liver. And that is due to the fact that the diet is really high in corn, tortillas, tortilla chips, a lot of corn derivatives, as well as peanuts. So peanuts, peanut butter, anything made with peanuts. And the reason for this is because these foods are really high in a toxin called aflatoxin, which can't be gotten rid of even with the use of pesticides. So even organic peanuts and corn have aflatoxin, and this aflatoxin leads to cirrhosis of the liver. Another thing that leads to cirrhosis of the liver, besides other diseases and alcohol, is not drinking enough water. And so, because what happens is the liver starts to do the job of the kidney plus its own function of detoxifying fat soluble toxins, and it
And
just becomes overtaxed.
and what will be the right amount of water that we should drink, doctor?
Oh goodness.
Daily?
So it depends. Yeah, very good question. It depends on the person and their activity level, their metabolism. But general rule of thumb is what we've all heard is about eight glasses, eight 250 ml glasses a day, minimum, and up to 2 or 3 liters, depending on how much we exercise and sweat, how much muscle we have, our body composition. But yes, when we urinate, it should be pretty much clear, or just slightly yellow.
Because I heard
Because
even drinking too much water is not good for you, right?
um, you know what? Anything too much is not good for you. But
Yeah.
it's really hard to get. It's really hard to get too much water,
Yeah.
unless you have kidney issues or any specific ailment, where you just don't get rid of all the extra water. And
I
so
see.
so yeah. Otherwise, it's not unhealthy to drink too much water even.
But going back to the liver, and we mentioned it earlier. There could be also liver damage because of COVID.
Yes, yes, and that is due to the fact that in COVID we have a limited, in many COVID patients we see a limited red blood cell count, and that decreases the amount of oxygen in our blood. Okay. And so when that oxygen level falls below 90%, which can be measured easily with an oximeter, which just goes on the end of your finger. And we see a lot of COVID patients that fall below and they don't even realize it. They're hypoxic. And in that case, what happens is that limited oxygen supply to all of the organs, for that matter, including the liver, causes liver damage because we just don't have enough oxygen and nutrients even going to those organs. So there is damage to those organs that we don't even realize until later on. Um, Later on, as we go on in life.
And doctor, what will be the normal treatment for patients with damaged liver?
Okay, that's a good question. So, as I've mentioned before in our past podcasts, and it's worth mentioning again because it's important for new listeners to understand how the treatment goes. Our treatment is very, very comprehensive. So, we start a pre-treatment protocol with some key dietary additions and eliminations. Nothing that is unsustainable, okay, for the patient, and it's very individualized. So we will add some key factors there, as well as some key supplements to get the body ready for the stem cell treatment. And then once they do come to Guatemala for the treatment, we do a detox, an intravenous nutritional detox, as well as suppositories, organic suppositories, and intramuscular B shots to start the detoxification process for the stem cells, and to receive so the body's ready to receive the stem cells in the most healthy manner. And we also start oxygen therapy, which we continue after the actual stem cell treatment, as well as age appropriate hormone therapy, growth hormone therapy, as well as finally a stem cell enhancement formula that includes herbs and key minerals that help not only to prepare the body to receive the stem cells, but to help the stem cells continue to regenerate. And we continue that along with addressing psychological and emotional factors and aspects of healing, which is so important to include in the treatment, because that is a big part of our well-being. Also, that goes neglected many times. So we address the psychological and emotional aspects as well.
Excellent. So we can say that we can treat the alcohol-related liver disease and also hepatitis.
Absolutely, absolutely. In the same manner, it leads to liver damage in the same way, in very similar ways, and it's a matter of applying the stem cells intravenously in a way that it gets to everywhere the blood flows, and especially the liver. And what happens is when there is damaged tissue, and in this case, if there is damage to the cells of the liver, those cells specifically secrete chemical messengers named cytokines. And those are specific for those damaged cells. And so the stem cells know exactly where to go because of those specific chemical messengers in order to heal and regenerate the damaged tissue. So our body is very, very capable and very competent in healing itself in that way.
So, how long will this treatment last? I always ask you that, but I don't know if it varies from one patient, from one disease or condition from the other.
To another.
Yeah, to
Very
another.
good question. Yes, Louise. It is very individual. It depends. Yes, it is very individualized, and so it'll depend on what we need to do in terms of the treatment. But it can range in general from 7 to 10 days, and sometimes in some cases 14 days. Again, depending on what we need to accomplish. However, the general time frame is 7 to 10 days.
I see. And if, in case the listeners have any inquiries, if they want to ask us anything, when can they reach you, doctor?
Yes, one of the best ways is reaching us by email at info@stemcellhealinginstitute.com, all one word. They can also reach us by phone. Our US number is 209-690-7836. That's 209-690-7836. Our local Central American number is +502 4220 7297. I'll repeat that. +502 4220 7297. You can also reach us on WhatsApp with that number, as well as our website, www.stemxcure.com, all one word, and Facebook and Instagram. Did I miss anything, Louise?
Yes, the other website, Stem Cell Healing Institute dot
Institute.com.
com. That will be
That's right.
the main website, and you can also write us at the info at Stem Cell Healing Institute .com, like the doctor said. And
As well as YouTube. They
yeah,
can visit us on YouTube and
yeah, you can listen to our podcast in a video format on YouTube and also, well, on our social media, Facebook and Instagram.
as well as Spotify. Is that correct?
Yeah, Spotify. You can find this podcast on Spotify.
Excellent.
Doctor, is there anything else you want to add to this podcast?
No, I think we've covered all the bases. We're looking forward to welcoming any questions and inquiries from our listeners.
Excellent, Doctor. You keep enjoying your vacations up in Canada. Lucky you.
Thank you. Thank you so much. Thank you so much. And thank you to all the listeners.
Okay, have a nice day, Doctor.
Thank you, Luis.